Connecticut.
Thank you, Mr. President. I want to pick up where my colleague from Hawaii left off. There was this wonderful analogy that President Obama used after the 2016 election. As you can imagine, Mr. President, Democrats were pretty dejected the day after, and President Obama put it pretty simply. He said, listen, just remember, these elections are intramural scrimmages, right? We put on temporary pennies, Republicans and Democrats, but in the end, we all belong to the same team. We're all Americans. And elections and legislative fights are just temporary skirmishes before we recognize and realize our greater identity, which is that we have this commonality. And clearly, that's not what the American people see here, right? They think that our primary identity is our partisan identity. And there's a lot of days in which we give them fodder for that belief. But it really is amazing when it comes down to it that when you think about the healthcare system, we do have the same goals in mind. There are actually lots of other issues in which we actually don't have the same goal, right? Republicans want to go left and we want to go right. Republicans want to go right, we want to go left. On healthcare, we actually all want to get to the same place, which is more people have access to health insurance, that the cost of that insurance is less than what it is today, and that the quality of the care that people get is better. And it's funny because underneath that, it's really just mechanics, right? It's not actually ideology. It's just a decision as to which lever you press and which you don't. And so I get that a lot of my Republican colleagues don't think that we're sincere when we say, if you put this monstrosity of a bill aside, we will work with you to do something better. But it's sincere. Now, we don't want to blow up Medicaid. We're not with you on that. We don't want to pass along big tax breaks only going to the very wealthy, but we get that you want some more flexibility for states. We get that you want maybe an additional plan offered on the exchanges that doesn't have all the bells and whistles that the existing plans do. But you get that we want stability in the exchanges. We want some certainty in the markets going forward. There's a really important conversation to be had here. And our hope is that with this CBO score, maybe it will be the straw that breaks the camel's back that will cause our Republican colleagues to give up this nonsensical approach to health care reform and work with us. So I'm going to repeat some of the ground that's already been covered here in the next few minutes, but I do just want to go over some of the highlights of this CBO report. Senator Schatz previewed this, but it's sort of hard to get your head wrapped around what it means for 22 million people to lose insurance. This is an old chart from the CBO score on the House bill that held that under their approach, 23 million people would lose insurance. So I just X that out. We now have 22 million people that lose insurance under the Senate approach. That's the entire combined population of Alaska, Delaware, Hawaii, Idaho, Kansas, Maine, Montana, Nebraska, Nevada, New Hampshire, New Mexico, North Dakota, West Virginia, and South Dakota. All that happened between the House bill and the Senate bill is the people of Rhode Island got saved. So I X'd out Rhode Island because Rhode Island's about 1 million people, and so 1 million people more will have insurance under the Senate bill, but that's a humanitarian catastrophe, right? That's a big deal, to have that many people lose insurance. And I know that's not what you set out to do. I know that Republicans didn't set out to do this, in part because I listened to Senator Cornyn come down and complain on the Senate floor relentlessly that the Affordable Care Act still left a whole bunch of people without insurance. In fact, he sent out a tweet today highlighting that the CBO does confirm that if current law continues, there will still be a lot of people without insurance. He left out the fact that CBO says that under the Republican bill, 22 million more people lose insurance. But that's a whole lot of people. And just by the way, in the first year, CBO says 15 million people lose insurance. 15 million people is the entire population of 13 states. And that happens next year. Emergency rooms in this country cannot, in 12 months, absorb 15 million people losing insurance. And for all the folks that say that the ACA is in a death spiral, CBO says you're wrong, very flatly. CBO says that if existing law remains, even without any improvements, the number of people without insurance effectively remains static. Yes, at the end, if you make no improvements, you will go from 26 million people not having insurance to 28 million people having insurance. But CBO says, I had to change this because it used to be 51 million under the House bill. CBO now says 49 million people will lose insurance if you actually pass the bill that the Senate is going to consider this week. The death spiral happens if we pass the Republican health care proposal. That's not a death spiral. That's stability. It's not an optimal result, 28 million people having insurance, but it is far preferable to 49 million people having insurance. And I understand that Republicans will quibble with CBO, say maybe they didn't get it exactly right, but even if they were 50% wrong, that's still over 10 million people losing insurance. And by the way, just for good measure, CBO was right in their estimates of the percentage of Americans who would have insurance under the Affordable Care Act. Inside of their estimate, the details worked out differently, but they said that by 2016, 89% of Americans would have health insurance, up from 83% prior to the passage of the Affordable Care Act. Guess how many people have health insurance today? 89% of Americans, 89, 90% of Americans. We all agree that premiums should go down, that if we're going to pass something, the result should be that premiums go down. And here's what CBO says. Premiums go up, not by a little bit. They go up by 20% in the first year. Now, after that, admittedly, CBO, I admit that I'm painting a partial picture here. That's just 2018. After that, CBO says that for certain populations in this country, premiums will go down. But it's largely for the young, the healthy, and the wealthy. CBO says that you will have massive premium increases for older Americans, for lower income Americans that are in that 50 to 64 age bracket. Your premium increases will go up by at least 2 times, up to 4 times. And CBO says that if you're lower income, you're just not going to buy insurance because you can't afford it. So it doesn't even matter what your premiums are because it's going to be so high that you can't afford it. Premiums go up for everybody off the bat and for lots and lots of vulnerable people after that. And so who gets hurt? Well, everybody, except for the folks that are getting tax cuts. If you're an insurance company, a drug company, or you're super rich, maybe that's an unfair term. It's for people making $200,000 more or more a year get tax cuts, but most of those tax cuts go to the super rich, people making over $1 million a year. You do fine. If you're an insurance company, a drug company, or you're very wealthy, you get a great deal out of this piece of legislation, but pretty much everybody else gets very, very badly hurt. Today, one of our Republican colleagues said this to a reporter, and I won't give you a name. One of our Republican Senate colleagues said when he was asked about the Republican health care proposal, he said, quote, "I'm not sure what it does. I just know it's better than Obamacare." I'm not sure what it does. I just know it's better than Obamacare. That's about as perfect an encapsulation of the Republican positioning on this bill as I can imagine. Because if you did know what it did, if my Republican colleagues did get deep into the CBO report, it doesn't solve a single problem in the American healthcare system. There are big problems. 26 million people still don't have insurance. This bill makes it worse. People are paying too much for insurance, especially those folks who are making middle incomes, who are just outside of qualifying for the ACA subsidies. This bill makes it worse. Almost every problem is made worse by this piece of legislation. And I guess that's sort of what a lot of Americans wonder, if our Republican colleagues do know what's in this bill. I'm not sure what it does. I just know that it's better than Obamacare. This solves one problem for Republicans, and it's a political problem. Republicans said for the last 8 years that you were going to repeal the Affordable Care Act. My Republican friends promised it in every corner of this country at every opportunity they had. And this does solve that political problem. If you pass this bill, you can successfully claim that you have repealed the Affordable Care Act. But that's the only problem that it solves. It makes almost every other problem in the system worse. Number of people with insurance go up, premiums, especially for the poor and the vulnerable, go up. There's nothing in this bill that addresses the cost of health care, of drugs, of devices, of procedures. There's nothing in this bill that talks about the quality of health care. Every problem, virtually every problem in the healthcare system gets worse. And so I'll just end by reiterating the offer that Senator Schatz made. I think you have a lot of people of very good will that want to work with Republicans, are sincere about it. I'll be part of whatever group gets put together if this bill falls apart this week, because I held an emergency hearing in New Haven, Connecticut on Monday, just to try to explain to people what was in the Republican Senate proposal and to get people's feedback. And it was hard to sit through. It was 2.5 hours of some really, really scared folks. And I'll be honest with the presiding officer, most of the people who came had disabled kids. Most of the people who came had disabled kids who were on or relied on Medicaid, and they were just scared to death about what was going to happen to their children. But they also talked about the problems that still exist in the healthcare system, the fact that their drugs were still too expensive, the fact that many of them still paid too much for health care. They wanted those problems solved, and they wanted us to work with Republicans on it. Senator Schatz is right. If we did this together, we would own it together. It would stop being a political football. And while that would be a secondary benefit to the actual good that would come from a bipartisan piece of legislation that actually addresses the issues in the underlying healthcare system, it would be a pretty remarkable good that is possible. Because we have the same goals in mind. We both want the same things, and it is just in the end of putting aside this bill that makes all of those problems worse, and instead sitting down together and deciding which levers we want to push to make things better. I yield the floor.